really quite normal looking person.
Thanks.
Let's see.
Because we were actually meeting face to face, I brought my other meds just so you can see how it comes. Because I don't know if you ever have a cannabis patient or whatever, but it comes like this. And I get it from
Well, I have patients that tell me what to take, but I've never seen it before.
Yeah, and this one usually comes sealed in that, and that's it. I'm near the end of my prescription, so I'm due to get it refilled.
Oh, is this all?
And that's the one I would take in the day, which is a lot less stronger than the one I would take at night. So
and so they're wee plants basically, and you
pretty
take,
much just
what do you take for a dose, or how do you take it?
Well, because I grind it up, so it's pretty much
So how much do you grind
so I'm
up?
supposed to, well, just I don't know. I don't know how to just
more.
Well, probably. Well, I grind up a lot, and then when I take it out, it's just like a fine line.
Yeah.
And then I mix it because it says to vape it, but I don't vape it.
Okay.
I don't smoke tobacco either. I mix it with.
For some reason, I thought it was cannabis oil you were taking.
Well, I did get I was on CBD oil as well, but with my arm, the doctor actually prescribed me an oil for that because that helped a lot. But so I mix it with dried flowers, like raspberry leaves and calendula and red clover, sweet clover, and then I smoke it.
I used to smoke it.
Yeah, but that's my vice, and I actually do enjoy a smoke. It's a stress release thing as well. So, that would be how I take that then.
And how often then do you smoke it?
Every day.
But how many times?
1 in the morning, and then possibly 2 in the evening.
And it's like a line of it, and you roll it yourself, do you?
Yeah. I should have brought. I don't even have any pre-rolled because I've only had one today. No, but it's good to kind of know.
Yeah.
So yeah, no, I would normally I'd actually sit and roll a big batch for a couple of days worth, and then I just carry them all in a wee pouch. I never go anywhere without this pouch. So I carry them in this, and then in this is like a strip of cyclazine, a strip of cocoa malt,
Right.
Imodium, and then my CAN card in case somebody stops me and asks what I'm doing in public, I can show them that I'm legal. Okay. And so this is like my survival kit. That's it. So
that's like a wee thing I bring on holiday, with your Imodium and your steri strips and your.
I don't go anywhere. I wouldn't go shopping without it,
Right.
Okay.
So,
do you need this off or anything?
Not. So you're okay up here. Yeah.
Tender.
And then
Getting
just
tender.
really small your back there. Really bad
it's
there.
right here, yeah. Because I'm sitting, it's easier. If I stand up, it gets worse.
Your left side is worse there.
Yeah.
And what about in there? So we're
just tender. It's just like
worse
wherever you're going near the epicenter.
And then this side, you see it?
Not as tender.
And then if I press over your buttocks, like, do you feel the pain right in your butt? Like where your lower hip, where you're sore there is actually over
here. It's like right here.
So that's your posterior superior left spine, and then you can get a lower bit of your pelvis, which is right inside your butt.
So it's hard to know because then when the pain's going through my butt, it's going also down to my thigh.
Okay.
So when I move, that's where the pain worsens.
Can you lie up here in the bed for me a second? Yeah. I'm just going to do a couple of things. But this is just new.
Or does it this?
Yeah. And when did this get real? Like we were like, oh my goodness, this is really bad.
Tuesday morning, I woke up and I was like, what way do you want to
lie back, just lie flat.
My pie had hurt her.
So it was never debilitating before.
No, there would be times I could maybe feel like it was going to lock or something. But again, the horse thing, I don't know to do that.
You do on Monday or Sunday?
Monday. So the dogs were boarding until Sunday. And then Monday, Luna woke up with a lame paw. So she's 5 months old, so she's a lab retriever. So she's still quite small, but she's 50 kilos.
Yeah.
I had to lift her and put her out because she's not house trained. I think it might have just, that's the only thing I could think of.
Sometimes it can be, or other people would come in and would just go, oh, that tree bent down to lift a bag of shopping and didn't even get lifting it, just didn't get up again. Yeah. So it can be something like that.
But it's so sore.
Well, straighten, but with that leg sore and you do it like that.
The back sore when I do that. Ooh.
Right, I'm going to get you to lift your leg up straight as far as you can.
Okay. Before pain or?
Yeah. Starting to get pain.
Pain, and it's feeling
more there, right?
Tight in the thigh here.
That's fine.
Oh,
that's alright. Okay, you relax, let me do it now. Okay. Is that sore? Not too bad. That's pretty good. It's really good.
Hard to...
So you're still young. You say that means that's good. Hopefully hopefully no arthritis. Straighten this one, do the same.
That one's fine. That one was a lot
Definitely not
easier.
bad, but you're getting stretching sort of more there even. Okay, that's good. And if you, I'm just going to bend this.
Oh, that's relief.
That's
That's
okay. Now, if you twist your hip, is that sore?
It's uncomfortable.
A wee bit? Yeah. Okay. Yeah, I think it's probably more your muscle and your lumbar spine that you've just pulled. And now, any problems going to the toilet either way, you're not incontinent.
My meds help me.
We ask you this.
Coffee and meds keep me regular, I think.
Let me switch. Okay. Right. Is your smear too? I'll just check here. It's coming up for some reason.
Maybe. Might be.
Don't worry, I'm not going to do it today. Yeah,
Thank God.
it would be 5 years, like sort of now the time when you should. So probably just get an appointment with Jackie on the way out, even our practice nurse.
Okay.
It's just best to have these things done.
Yeah,
So
I
they
do normally keep on top of them. What's the age for breast screening?
50.
Really?
But obviously, if you notice anything, lumps, anything like that, why? Do you family history?
Not that I'm aware of, no. But I've just been getting like I would get cysts and things anyway. I've got a really painful one up here above my ear, and I get some behind my ears. But I've had some. I don't know if they were cysts or what. On my boobs, and then I was like, is it the bras doing it? You know, and the rubbing, because I've went up in clothes sizes, and you forget that you also have to keep catching up on your bras as well. But I normally live in sports bras anyway. But there was just, every time I'm wearing one, it rubs, and then something develops, and it's sore and tender.
Both sides?
Yeah, it could be, but yeah, it would be happening on both sides. Not at the same time, it could be one or the other.
Probably isn't.
So it's just
serious,
because that lid just
probably
be
something to do
tender.
with your bra, if it's happening both sides. Where do you go to? I mean, obviously a medical thing. If you think there's anything to fail, then you come make an appointment with us and we can examine your breast.
Yeah,
and
I have been checking them, but it's
So
to be honest, you're kind of afraid as well to actually go looking to find something.
Well, action cancer as well, if there was something that you didn't think, well, actually I don't have any specific lump that I can feel, but there are recurrent things. Sometimes they would organise a scan.
Yeah.
But obviously we can refer to the breast clinic at any point if you do have any signs of anything. Right, I'm asking you about bowels and bladder and incontinence and all, because you can get, if you ended up with a central disc prolapse in your lower back, that would mean you would lose all control. It's an emergency. You go to hospital. That's why we ask you about these things. Pain relief, probably for something like this. Anti-inflammatories are the best.
It's the stomach thing.
But you maybe just can't tolerate it, and the other thing you're getting is a bit of sciatica, the nerve irritation down your leg. So you may benefit from. So our choices here are: do we add in a small dose of naproxen and make sure that, I know you're saying only 2 meals a day, but just as long as you're taking it with food. I think you've no history of ulcers, bleeding ulcers or anything in your stomach.
I don't know so far.
No, you've never vomited blood or anything.
No.
I
do vomit for work though, but not blood. I do vomit with the anxiety and migraines and that, and then it messes me. So it's.
So just if we thought you would take, or you thought yourself, yes, I will take some. Make sure you take some food. If I am taking that tablet, it would help. Something that's flared up in your lower back, and it will. It's best for muscle pain, to be honest, and anything around your bones. It's not connected to a fracture. You haven't had any sort of trauma as such. Cocodamol, stronger cocodamol. Probably it is an option. You'll get more constipated with it. It is addictive. The 8500, you'll not get the same. They are taking the edge off it. And we could do, if you were like, just, you know what, I'll try we could do 15500 or something, which is twice the strength of the cocodamol you can buy with a counter. But just be aware that it's not really going to do any healing as such or reduce the inflammation. It's just trying to zap the pain a bit, and it will constipate you. Is the other thing. The more codeine you get, more constipated you'll be. Amitriptyline
Yeah, Delriata mentioned that. I'm
Is
not
an
keen on
option.
that. They
It's
said a
probably
mild
a very good
diazepam.
option if you pain down your leg. Diazepam is not an option.
Oh, they said, because I said no to the amitriptyline thing, she said a mild diazepam and 10% ibuprofen gel, because I told her I was using that Uttermint, because one of the treatment nurses recommended it.
Diazepam would be something that we would advise on a sort of just at your stage, and for obvious reasons, I don't think it's a good idea.
What's the obvious reasons?
Addictive.
Right.
As in, anyone can get addicted to diazepam.
But am I not being prescribed it because of my other prescription? Or why am I more at risk of addiction?
Well, about 99% of our patients aren't getting prescribed it.
Right.
Because, well, the board come down a handful on us because of prescriptions, but we're trying to get patients off it, not on it.
Right.
So if I thought you needed it, I would give it to you.
Okay.
But you haven't tried any of the other things.
Yeah. Well, I have tried diazepam before, but I haven't tried amitriptyline, but that's an antidepressant kind of thing. And
it's an antidepressant.
Not going there.
75 milligrams. I am not giving you anywhere near that. If I was giving it to you, I'd give it to you in 10 milligrams. That's what you get started with, 10 milligrams. Have you ever had it before?
I'm not a fan for Lena. If I'm coming for meds, I'm in a bad way. I prefer holistic therapies and stuff. I'd rather be going for acupuncture than doing this.
Why you definitely wouldn't want diazepam. You know, if you don't want amitriptyline, you definitely don't want diazepam. That's where I'm coming from.
It's only because I've taken diazepam before. I've never taken amitriptyline, so I'm kind of like.
Well, that's
but
there's lots of things you haven't taken.
Yep, that's true.
Are you still taking the quetiapine?
No, stopped that last year.
And you're okay without it?
Absolutely.
So
it was
take you off it and repeat, yeah?
Oh yes, please take it off. I'll never be going back on that. A migraine put me into.
Who put you on it? Did I not?
No, it was.
Or I thought maybe I prescribed it, but it was on someone else's advice. No?
I had a psychological report done for my employment case.
Okay.
And with the diagnosis that came with that, the doctor put me on quetiapine, and at the time there was a bit of a relief and it was needed and it was good, but after 6 months I did not feel good, and then I had a stinking migraine that threw me actually into withdrawal. I thought I was going to die, and I swear I'd never go back on it. My cannabis meds do the job. If I can self-care and do everything else that I do, I'm okay. It's just with the stress of the case and everything as well, it was needed at the time. But
that's all right. What was your diagnosis?
PTSD, chronic depression, EUPD, which I don't really agree with.
What was it? Oh, right.
And there's one more, I can't remember.
So it was maybe for the emotionally unstable PD?
Probably, yeah, but
not bipolar? Okay. Yeah, you know, you don't need that if you don't need it, basically.
It was just even just taking it, you know, within an hour,
I was
not fit for purpose.
I might take my words back about diazepam, because you're not, well, obviously you drive, don't you? So you can drive if you were getting the diazepam that we would give you for acute back spasm. Right. And it's a no-no.
I can't drive a Coco the 8/500s. I don't even drive on them
either. You
either.
definitely wouldn't. I mean, normally I would give somebody diazepam 2 milligrams, but for somebody with acute muscle spasm, it would usually be 5 milligrams 3 times a day.
Oh God.
Exactly. That's what I mean.
One of them would probably do me. I'm such a low dose person. It's great.
But it's not. Generally doesn't work for the nerve irritation that you're describing. The other thing, which you maybe not heard of, is called Robaxin, which is methocarbamol, and it's for acute muscle spasm in short-term use. Right. Which is an option. And it shouldn't affect your stomach. Yeah. But again, you've never had it before, so there might be side effects you might get. Yeah. Try. So it just says here,
I'm just wary of things as well in case things are like likely to trigger seizures and stuff. I've been seizure free for a very long time, so I don't like to risk that either. Do you know?
Right.
I think that's why I questioned with the amitriptyline, the girl at Dalriada today. Just what is it? Tell me what it is. Because I'm just very cautious about it. I've heard it spoke of, but I don't really know it. Do you know what I mean?
it's used for loads of different things, and it can be a really useful, really effective drug. It's used for prevention of migraines. These are all low dose. I do 10 milligrams to start with. Prevention of migraines, irritable bowel, like dysfunctional bowel syndrome.
Right.
Any sort of nerve pain, like from shingles or sciatica,
Right.
where it's not pure muscle pain, pure bone, anything like that. I'm not sure if I've ever prescribed it as an antidepressant because it's so old.
Right.
And if you're giving it as an antidepressant, it is 75 milligrams that you start
That's
with.
a high thing.
I reckon if I give you the 10 milligrams, the only worry I have with that is that, well, it'll help you sleep. You take it at night time, it helps you sleep, but you might actually feel really groggy the next day. That's the main side effect with it.
Because people like that too. Like,
it is. It can be too. But that would be the big thing with it. But once it's sort of, you get used to it, if you did need to. So my thing would be, if something like this didn't do the job, then we might have to think about amitriptyline if this is going to be a chronic thing. Let's hope it's not. Let's hope it's just a wee kind of flip. But
the only thing for me with the grogginess the next day, I already have to fight an awful lot of fatigue. That would just be such a setback for me. It already takes me about an hour or two to get my day up and running, you know.
Do you know what? I've never read all these side effects, but you make me read them all.
Sorry.
Methocarbamol says seizure, so I'm not giving it to you.
Thank you.
So I'm going to give you diazepam, right?
Okay.
The options are diazepam, and probably with you 2 milligrams 3 times a day will be enough. For 3 days.
Okay.
Or cocodamol 15,500. Do you want them both? And work with it?
I have the 8. See, to be honest, when there was a time I was at hospital, and did they give me 15s or was it the 30s they gave me? And I just kept snapping them in half because it was too much.
You can do that, or you can just take one with a paracetamol.
Yeah.
In effect, that's the same as taking 2 8,500s.
So, yeah.
And if you find that they are...
Like I usually, with my migraines, it usually just takes 2, and then that takes, because I seem to be getting migraines at the start and end of my period now at the minute.
Migraines, not cocodamol. You'll end up with a codeine-induced headache. Cocodamol is the worst thing to take for headaches.
They're the only thing. The 8's over fit that works. It is the only thing, and it's been steady at that. That's the only thing that works. So once maybe they stop being effective, but one box. I mean, I know it says on the thing more than 3 days use, but a box could last me 3 months. That's why I don't get a own prescription, because it's just not, the migraines, they're only becoming a wee bit more regular.
You have naproxen, I just looked.
No, the doctor prescribed it, but I didn't cash it in.
Oh, did you not?
No.
Yeah, and it was the lower strength, and we did give you stomach tablets and all with it.
I know, I know, I told them, but I just didn't want to take it, because I'm so concerned about my gut, but I haven't got it sorted yet. So until I just didn't want to go, because it's already upsetting enough, because it can make me feel quite sick. I don't know.
Sort it out?
Well, I'm trying.
You need to sort it out yourself.
I have food intolerances that got tested at work, but I've never had it checked thoroughly from yourselves. You know, it was just like this a big health well-being day at work. So I went and got them. They told me. So it's pork and wheat. So now I've had to adapt my whole diet, and then I had to do all that while me and my kids couldn't really afford to eat, and then we were dependent on food banks, and then they said you everything with pork and wheat. So it's like, and I'm allergic to citrus.
Like the only thing we'd be testing for is celiac, gluten intolerance, which
apparently I can eat gluten. I can't eat wheat.
But you nearly know if you are, it's trial and error if you're intolerant to something, see.
It is, so, but just mixing that in with the whole eating pattern and that.
Somebody about 10 minutes ago. So what we're doing here, we're going to go some diazepam for 3 days, and just stick with your cocodamol 8500 for now.
Yeah.
And then ring up if there's anything ongoing. Obviously keep an eye on the bowels and that, but your bowels are pretty regular.
Yeah, they are, too bloody regular.
Diazepam's obviously something we use to treat seizures, so it will not give you a seizure.
Okay.
Which is reassuring.
Yeah.
And you say your weight's going up?
Well, my diet wasn't great. I was living on Pepsi and Pepsi and coffee, and then my dinner late in the evening with the girls, because I didn't want the girls to not see me not eating. But my house dynamic has changed a little bit, so my girls have moved out.
Okay.
So I've been able to kind of focus a wee bit more on me, get
What age
eating
are your
breakfast.
girls?
16 and 18.
Okay.
You might actually have a referral coming for Emma because she's being referred to counselling.
Right.
Um,
Emma who? King? Okay. Right. Just to confuse me.
Daddy was arrested in June for possessing, creating and distributing indecent images of children.
Okay.
So I think...
Where's she living?
She was living with Dad. Me and the girls had an argument in March. I said to them, like, you need to treat me better or find somewhere else to live. So they went, Bamble, and off they went.
So the two of them are with him?
The eldest is with him because social services won't touch her because she's 18. So the youngest was removed from his care.
Right.
She's currently living with Granda. I'm having a court order.
And is it your dad? No, his dad?
His dad. My dad's dead.
Okay.
So,
That's right.
yeah, his dad's house was the scene of the crime.
Oh, I know.
Oh Lord, I'd need a longer appointment with you to fill in.
You would.
I really would.
You need a coffee appointment now, the sound of it. Listen, see how that goes, and yeah, I mean, I'm happy to work with you. We'll see how we get on.
Just the girl in Dalriada said this can take like 6 weeks to get better.
Well, it could do it.
I have 2 dogs. It comes in 6 weeks. I think I have a business presentation and everything to give. It's just a bit of an inconvenience.
I appreciate no, but it's maybe it's things like this don't settle in. We have to get you seen by a physio, get you seen by someone else, and so on. Because it can just come out of the blue, these things. And
I just feel like I'm falling apart, to be honest. But
all right, listen.
Thanks very much.
At least you don't have a kidney infection. That's amazing.
Do you know I used to
Yeah,
be with
that's
them? I'm
positive.
glad. I'm glad.
All right.
Thank you.
I was just